Welcome to this Tutor to You Sociology topic video looking at models of health, focusing on social models of health. The alternative to the biomedical model of health is the social model of health. Social models of health focus on the causes of illness, disease and injury as being based upon social factors and how these influence the health and well-being of individuals. Social models of health look at indicators such as levels of deprivation, adequate housing, working conditions, and access to a healthy diet, exercise, and other aspects of a healthy lifestyle. Social models, rather than focusing on an individual's biology, assess the impacts of social inequality and see this as being the primary cause of differences in the life expectancy of individuals and the amount of years they can expect to live in good health. Sociologists who favour social models of health criticise the biomedical model because it fails to recognise the impact of social and economic factors on an individual's health. Trends in the UK clearly demonstrate higher levels of life expectancy in areas that are perceived as affluent, whilst areas of deprivation have lower levels of life expectancy. Social models of health take an epidemiological approach to health, studying these patterns and distribution of health outcomes across different social and economic groups. According to social models of health, what individuals perceive as good health and illness are often subjective and based upon an individual's interpretation of the condition and the interpretation of medical professionals. Doctors may perceive women to have higher thresholds for pain, for example, and therefore are less likely to diagnose complex conditions that impact on daily lives. Furthermore, males are less likely to perceive themselves to be unhealthy if they have mental health issues, and this is a result of their socialization. A good example of social models of health is the Marmot Review of 2010. Undertaken in 2010, it outlined 6 key social factors that could reduce health inequalities in the UK. These included the improvements to the standard of living, good employment, and giving children a healthy start in life, as well as improving access to healthcare services for all. 10 years after its publication, the Marmot Review was revisited, and it was found that there had been little progress over the past 10 years. Improvements in life expectancy had stalled, whilst the time spent by individuals in poor health had increased. Furthermore, there were marked regional differences between health outcomes, with a clear north-south divide shown across both life expectancy and time spent in ill health. Further research by Marshall et al. Found that life expectancy had stalled and was actually reducing for women in the most deprived areas. One reason provided for this was that life expectancy is measured over the longevity of an individual's life, and that the social and economic changes of the post-war era, for example social housing, creation of the NHS and social mobility, had led to a large increase in life expectancy, but that further changes had not been put in place since. Simply put, life expectancy in the UK had risen so rapidly following these widespread changes that any further changes, which can be argued to be minimal, had seen little effect on the life expectancy of those born today. Marshall et al. Commented that the strongest influences on people's health are the social, economic, environmental and commercial conditions of people's lives, the wider determinants of health. This shows the impact of social changes and how medical advancements have made little impact on improving health outcomes in the intervening years. In evaluating the social models of health, it's important to examine some of the success of the biomedical model in order to demonstrate that which social models fail to explain. For example, how immunisation programs have reduced infant mortality and eradicated diseases that were once life-threatening. Measles, mumps and rubella have all been reduced, although recent cases of measles returning had been seen by some as a result of increased deprivation in society. Other medical advances have extended life expectancy of individuals. Improvements in the treatment of heart disease, cancer and other life-threatening illnesses have meant that people are able to recover from these illnesses and live full lives. Furthermore, the use of antibiotics and antiviral medications have reduced the time spent with illness. However, social models of health can be used to explain the higher rates of COVID-19 transmission amongst certain occupations, particularly those in the working class. Hospital workers, transport workers, and retail staff all had higher rates of transmission of COVID-19, and this demonstrates how social factors such as employment can impact on an individual's chances of becoming ill. That concludes this Tutor to You sociology topic video looking at models of health, focusing on social models of health. Thanks for watching.